Does it seem crazy to you that we're deploying huge resources to counter the COVID emergency, but not to the BC declared drug emergency? According to the BC Coroner Service, over 1,700 people died of tainted street drugs last year, while approximately 1,300 people died of COVID in the same year, according to the BC Centre of Disease Control. In other words, a little less than a third more people died from poisonous drugs than from COVID. Put another way, BC is experiencing nearly 5 deaths a day due to illicit drug poisoning, and more than 6,500 families have been affected by the tragedy of losing someone to what is a preventable problem. Why is this tolerated? Kat Wahamaa of the organization Mums Stop the Harm, who has lost a son to tainted drugs, speaks to this disconnect and the terrible unnecessary loss to our society and the pain and intergenerational impact of trauma experienced by bereaved families.
So, Kat, I looked at the website for Mothers Stop the Harm, and I was just stunned at the photos of all these mostly young people who have been lost, and it's just heartbreaking. And also it seems that your organization has done a lot. It's quite amazing. Could you just tell a little bit about when the organization was started and why it was set up?
Leslie McBain and Lorna Thomas and Petra Schultz, and I believe it was 2016. So it's been going since that time. Obviously, the focus is on raising awareness, and I'm sure you've looked at our stuff online in terms of the brochures, etc. And basically, it's an advocacy. We're calling for reform to drug policy. It's safe supply, decriminalization, all of the things that we know are science and evidence-based to make a difference. Just dealing with the stigma associated to, it's been a long 5 years. What other epidemic is taking place that's taking the lives of thousands of Canadians a month that is not being addressed in an evidence-based way?
So in terms of the advocacy, do you feel like you're making some inroads? Does the organization feel like it's making some inroads with governments and police?
Police forces themselves and their organizations are calling for this. The decriminalization, simple possession, etc. But certainly, I do believe that Moms Stop the Harm and the work that's being done has helped to move things along the continuum to where we need to get to. And that's everything from the most grassroots, and that's how it obviously started, as very grassroots, in communities, being part of community action teams, doing presentations to the Rotary and whoever else needs. Also, though, at provincial and national and international levels in terms of advocacy. So we're connected to a lot of other organizations as well, because we're stronger together if we all come together. And that also includes the drug user networks like the BC and Yukon Association of Drug War Survivors, Canadian Association of People Who Use Drugs, etc. And those organizations have been in place for decades, and we work as allies.
Mm-hmm. Now, did your organization, it sounds like it came into being about the same time that the fentanyl hit the streets. Is that essentially the case?
In terms of a health emergency in BC, was declared in April of 2016. So those things coincide, because this isn't an overdose epidemic, it's a fentanyl and carfentanil poisoning epidemic. So people aren't taking too much of a drug, they're being poisoned by what is in something that they may be taking that they don't even realize that fentanyl is part of the concoction. Mm-hmm. As was the case with my son when he died. He thought he was taking MDMA and it was fentanyl.
Oh my goodness. And how old was your son at the time?
He was 25, a
Oh,
father
my
of two, worked in the trades, which is a place where drug use is epic in the trades, and the lack of appropriate response, I think, is epic too. So I know you've had a number of programs about the downtown east side, and I applaud the work that's being done there and the drug users and people that are live there and are working there. But primarily the people that are dying in our province are not living in the downtown east side. They're living in the suburbs. They're males between the ages of 30 and 59, I believe the stats are. And so they're dying in their condos and their SUVs and washrooms, and because of the stigma attached to it. So as much as there have been so many campaigns to try and get that message out, that don't use alone, etc., it's still taking many people's lives because the stigma attached to it.
And was that the case? Was that the case for your son as well? Do you feel that he didn't really reach out because of the stigma? Or were you even aware of what was going on? Was he living with you at the time?
He's 25 years old. As I said, he had two boys who are now 7 and 8. He had trauma as a young person, dealt with some of that through drug use as a teenager, got through all of that, went to school, became a journeyman iron worker, and then was reintroduced to some coping mechanisms through his work. And so the work in trades itself can be a way for, it's isolating. People are away in grueling circumstances, working 16 hours a day for 21 days at a time. So there's a whole host of things I could talk to you about that whole issue, and it is an issue that is being tackled.
It seems a lot of the drug use, according to Dr. Gabor Mate anyway, is related to dealing with pain and stress and so on. And so you mentioned this with your son, that he had early on trauma. And do you feel that it was effectively dealt with by the medical profession? Is the medical profession aware of this link between?
No, because the trauma that children experience is allowed to continue just because of how we set up our family system. So I don't want to really go into
No.
We allow things to happen that shouldn't happen to children, and we send them into dangerous situations because of our notions of family and what children need. Even if it's an unsafe environment to put them in. Regardless of, what happened to my son is my personal tragedy. And unfortunately, it's a tragedy that plays out on a daily basis. So people that have lost a family member in this epidemic are dealing with a complicated grief, because it is not a private kind of thing that happens in a family, because it's being repeated every day. So we're inundated through the media, through whatever, the statistics, etc. So it just is re-traumatizing for the families. That aside, what I really like to focus on is the fact that we're losing thousands of people a month. And that alone, despite all the grief of the families, should be our focus. And as with any other epidemic, treat it accordingly. So right now, for example, we're giving out vaccine for COVID. Well, the vaccine that would help in our situation is safe supply for people. Right. And certainly we're much closer to being able to deliver that. We have a public health system that knows how to deploy help for communities, and that's what we should be doing, and it's not what we're doing. And in terms of decriminalization, because that's a whole harm attached to people who use substances that just is sometimes worse than the substances themselves in terms of traumatizing people having to deal with that. So imagine you wouldn't lose your family, your home, your everything if you weren't in the pursuit of something that is outrageously priced in an illicit market, and really dangerous because it's not regulated. Imagine, if you will, that many people dying of alcohol poisoning a month. We'd be doing something, as we did when that started to happen in Prohibition, because the alcohols being produced were being produced illicitly, and so they were not regulated. Or so we have a situation that has very definitive ways to address it, which we are not doing. And mostly that's just because we're lacking the political will to actually use science and evidence-based approaches to this. For me personally, I just really don't care what public opinion is, because it matters not in any other health emergency. We wouldn't be asking the public for their opinion on how to deal with COVID or Ebola or anything else. They wouldn't be seeking their opinion, because it isn't about people's opinions. It's about this is what works. And harm reduction is a big spectrum of everything from supplying people with what it is they need in order to just function well. And many other eras, we didn't demonize drug use and so we had many of our famous writers, poets, etc.
Yes.
We know they managed to function, and a lot of people can function. For some people, and that's so it's a whole range in between. We wear seatbelts, we use bike helmets, we do all kinds of harm reduction every day. Reduction related to this particular instance doesn't become this fraught. And so what we're doing right now is we still have the ambulance at the bottom of the hill instead of the fence at the top. The ability to do the things we need to do right now. And so that's what I think that we find very frustrating.
Well, really what you're saying is the crux of the problem is that the political will isn't there, because there isn't an understanding that this is a health issue, essentially.
It's a human rights issue as well.
Right. Yeah.
Substances have rights, and that's where I think that the importance of peer-based advocacy drug user groups is vital, because we have so many other, we have 12-step groups and all these kinds of support groups, but many people have never connected with an advocacy group where somebody says to them, you are worthwhile, you are a citizen, you have rights, and your life matters. And that regard, everything else seems to be shame and blame and incarceration, which this doesn't
make any sense at all. Yeah.
Make sense at all.
Now, what at the provincial level, what's happening there? Is there an acceptance of this idea, and are they acting at all?
I think we have levels of acceptance. Dr. Bonnie Henry put out Stop the Harm, that report in 2019, a year before our COVID outbreak, about here's the things we need to do. And that includes, safer supply and decriminalization and those types of things. And so she's revered for her work in COVID, and I applaud that work. But somehow we've left that report behind and are not dealing with it. People understand. It's just that they look at the numbers and think people aren't going to support this. But I would think I believe there was a poll quite recently in the last week or so, and you can't quote me on stats, but it was showing that more people in every province actually recognize how important it is to deal with this in a different way. It's like the version of, the definition of insanity, doing the same things over and over and expecting a different result. The result is more dead Canadians, and quite frankly, it's a trauma of epic proportions. So it's a trauma for the families, and then it's a trauma for the responders. It's this ripple effect that is of intergenerational proportion. And as we know, this kind of trauma, losing, like with my grandsons, they've lost their father. That's trauma in their life. How is it going to affect them? And I'm just one example, and we're in the tens of thousands. What is it now? Over 20,000 people.
Now, you said something about 5 years ago, it was was declared a state of an emergency?
Yeah, it was declared a health emergency.
And is that like, did BC declare that, or did
Yes, that was
BC declared that?
And so the anniversary.
So BC declared it a state of emergency, but yet they haven't done that much, is essentially what I'm hearing.
Well, they declared that it was a health emergency, as COVID has been same. And so we can look at the different responses. Unfortunately, it's a stark relief between how one has been responded to and how the other has been responded to, and that's just the facts. That's
you mean the response to COVID versus the response to the harm of the drugs? Yeah.
Yes.
Mm-hmm, mm-hmm. And also on top of everything else, it's COVID that has caused, I understand.
It's exacerbated the issues for people that have substance issues, for sure. Everything from just how initially, when kind of borders closed down, the illicit supply then became even more toxic. The lack of ability for some folks to be able to isolate that kind of thing. So it just added a host of issues. And when everything closed down, all of a sudden, for those people that are more marginalized and living in precarious housing, etc., or were homeless, lots of services for them completely evaporated because they just shut down. I mean, we have learned to cope in some ways and deal with that. And certainly the community action team that I'm associated with, that's where our energy went. Shelter and food and basic things that people were all of a sudden adrift. The issue of the safe supply is a huge one, because now all kinds of concoctions are being put together that are another level of toxicity for people to have.
So in the Lower Mainland, what municipalities have set up sites? I know that New West is setting one up as of March 30th. Is there still the site open in downtown Vancouver? And what about, your area?
There are safe consumption sites and overdose prevention sites. Overdose prevention sites often are more community-based, where people grassroots are just putting them together. Some communities have them and they're attached perhaps to housing, like shelter, supportive housing, but there aren't a lot of standalone places. And we know that without safe consumption sites, we'd have way more deaths. There haven't been any deaths. So no one's providing them with drugs when they go to a safe consumption site. They're bringing their own things with them, and then it's a supervised opportunity, so that if there is a problem, there's somebody on hand to deal with it right away. There's also the advent of the Lifeguard App, so where someone is going to use, they can connect with them, so that if something happens and they don't respond, that there can be some energy deployed to see, okay, is this person okay? Because people are still dying on their own. And the main reason I think that there are communities that don't have, because they should be in every community, standalone opportunities for people to access, is simply because of the fear of public opinion.
Like the Lifeguard App sounds like a brilliant idea, so that somebody who wants to do drugs at home connects with somebody somewhere else and they'll check in?
Yes, that's how it works. And that's something I could send you some more information on. I don't feel qualified to talk about. Yeah,
but I think that's such a fabulous idea for people. And certainly that idea needs to be known by people.
There's information out there. There's websites, etc. So I can send you some information if you want.
And I think the other thing that people need to know is that the people that are caught up in this substance use disorders come from all different backgrounds.
It affects everyone in every socioeconomic background. I'm so tired of seeing news articles with a needle in a puddle. For one thing, most people are not needle users. They smoke whatever it is. And that's the other thing. If you're going to have an OPS, then it should have the ability to allow for people to smoke. The people who are living in the downtown east side, the first responders are people who live there on the street. They're the ones who are saving lives. The peers that are out there They are doing the frontline work, and they should be applauded for the work that they do. So they witness, they assist people, they support advocacy. And when somebody actually has the opportunity to go to a safe consumption site, all of a sudden they're connected to a whole network of people and possible resources that can help with other things, whether it's housing, the issues of wanting to access detox or whatever. They're starting to build relationships with people,
Right.
That can lead to other things in their life. But once people just stabilize themselves, other things can happen in their lives.
But they still have to access the substance in many cases.
Yes.
And I, as far as I know, doctors aren't prescribing, or are they?
I don't know where it's at this moment, but that was part of some of the avenues of dealing with some of this terrible impact of COVID is trying to get a safer supply to people. So that's come from Health Canada down to the province in terms of some controlled substances are being used but people have to navigate a system to figure out how to get that. And so I don't think that's happening perhaps as commonly or quickly as it could to assist people.
So any advice for families and users, about how they can keep their loved ones safe, or the user, how can they keep themselves safe?
Don't use alone. Even if you feel like your supplier is safe, there's still that element. And the other thing also, this isn't just in people seeking opioids. Obviously, it's infiltrated into things like cocaine and like MDMA, that kind of thing. So there isn't a safe anything that people can think of. So we've had plenty of people die that were just first time, second time users.
Yes.
Many people have lost their late teens, early 20s.
Yeah.
That situation. So do not use alone. Seek out things like the app, find safe consumption sites, OPSs. For families, I think we get caught up into a lot of disinformation that's out there about how to deal with our family members who are using substances. I certainly don't advocate there's no such thing as tough love. That is not, the people need. It's not workable. It's not harm reduction, that's for sure. It's not, and harm reduction is the way to go. Staying connected, because the opposite of addiction is connection, as Dr. Mate, I believe, like to say. And being connected, getting more information. It's very difficult, I think, for families. They get so much
information, from all over.
And Toward the Heart is a great site, and that's through the BC Centre for Disease Control, I believe. Go to Mom Stop the Harm. We have Holding Hope, which are groups for families with a family member who's experiencing issues around substance use. We also have Healing Hearts, which is a bereavement peer group for families that have lost a family member. Seeking out resources. A great book that I endorse all the time is Maya Salavet's The Unbroken Brain. So it talks about substance use and plenty of incredible information out there, how the brain functions, its plasticity, neural pathways, and how if we've, that thing. It isn't about person's willpower, lack of it. It's a whole host of other things that are, if we want to talk about trauma, we carry trauma in our DNA. We pass it along to our kids.
Yes.
So there's just a whole host of stuff that we're spending all this money on policing, etc., and not on the science and the research that we should be doing that could have tremendous impacts on this whole issue. But as long as we keep it in a back room, dirty secret, we're not gonna get anywhere, and it's so unproductive, and the deaths are so preventable. That's frustrating thing is we know that we could prevent these deaths. And this is a whole generation of people that we're losing. And my son had the potential to be, who knows, he could have been, invented something that
Yeah.
saved the world, stop climate change. We don't know because we're losing all of the people. We have no idea. It's, like I said, it's an epic trauma for our country that is going to play out for decades to come. And we're not confronting it in an evidence-based way.
Was there anything that you wish that you had known at the time that your son was using?
Oh, well, I wish I'd known lots of things. The one thing for me, I'm so thankful that I always stayed connected with him. So I don't have any of that regret that I know many people do have when they somehow disconnected from their family member. And yes, you have to also have boundaries to keep yourself safe and that kind of thing. The harms come from how we deal with substance use, more so than the substances sometimes themselves. Unfortunately, with our current situation, this is a toxicity in a drug supply.
Yeah.
People, they're not overdosing in the, what we think. And to make them responsible, and then it's a choice, and all, none of that's all rhetoric. It doesn't have any relevance to the real situation.
Yeah. What does the organization think about the various treatment centers out there? Are they doing a good job? Are they do they need more regulation?
I think they're all individual, and I guess the bottom line is they shouldn't be expensive, and they should be accessible.
Right.
And they should be evidence-based. I think it's our take on it. Is to we do need this continuum of services for people, and when they're seeking services, they need to be able to access them in a timely manner. They need to be accessible in all ways, especially from a financial perspective. It's part of our healthcare system, and it should be not something that's out of the reach of
most people. Yeah, a lot of these places are unbelievably expensive.
They are, and so, and I think we also need some kind of regulatory system of what is being provided and where's the efficacy, and so we actually need a bit more work in that regard.
Well, it also seems to me that mostly what is purported here is the AA style of abstinence. As opposed to stopping the harm. There's not much help for stopping the harm. There's not much, positive understanding among people that, reducing harm is probably more evidence-based, and it would also be creative.
Well, it is evidence-based because unfortunately any of the anonymous programs are simply that. So there's no statistical underpinning, and we know it works for some people, but we have no idea how many people it actually works for or not. And it's only one element in a spectrum, and so it may work for some people, but it doesn't work for everyone. And some people with whatever medication they need would be able to function quite normally. It's only because of how we respond to substance use that it cascades into these depths that make it really difficult for people to actually address what's going on by the time they get there, because they've been shunned by everything else and then forced into this life of drug seeking and what have you.
Now, is there a lot of evidence-based information, for example, of other countries? I know, for example, Portugal.
Portugal's a great example, but there are others as well. And that's the thing. We don't need to reinvent the wheel. The stuff is out there. Canada can craft its own response, but it can certainly pull from all of these other countries that have, have led the way. We should be leading the way on this. We'd like to see Canadians as compassionate and worrying about human rights. And yet this segment of the population seems to be completely abandoned. And they're for no reason, for the reason of a flawed drug policy crafted over 100 years ago that's based in racism.
I was just talking about this with somebody. We were doing the history of people that have come to New West, and really the opium laws were created in the first place by Mackenzie King in order to cast aspersion on the Chinese community.
Exactly.
And that's what it was about. It has nothing to do with...
Yeah, it has nothing to do with anything.
Yeah, exactly.
Yeah.
Exactly.
Yeah.
So any final messages that you want to get out there, or thoughts? Or what should we do as, generally as people, as citizens of this country, of a city, of a province?
We should do the right thing. We should follow the evidence-based practices, follow the science. As we do with any other, and as COVID has shown us, we know how to deploy resources. We know how to talk to the populace. We know how to do a lot of things. Why are we not applying those same things? Because it's taking the lives of way too many Canadians every day, every hour. It does not need to be this way. And as I said, this isn't just about the immediate situation of the person dying. This is a cascading tragedy of intergenerational proportion, and we need to start to address that.
Right. And this certainly can be seen in the Aboriginal population, the trauma and cascading through the generations, and it makes sense that this would be exactly the case here. And it's terribly sad. And it seems to me also that this has become like a political thing as opposed to a health thing.
And that's how it should be addressed.
So do you suggest people, write to their MPs, or?
That is what I always suggest, is that people do write to their mayor, their MLA, their MP, to the Prime Minister, because I think that's what we need. We need a tide of people showing, wait a minute, no, we are in agreement here. We recognize that this is what needs to be done, and now you need to take the legislation to make it so.
And we can't lose any more, and we're losing so many during COVID. It's just horrendous that this isn't done simultaneously with.
Yes.
It's very sad. Thank you so much. You had a lot of important things to say that are important to get across to people.
Thank you.
So thank you very much. And have a good day.
Okay.
Okay. Bye-bye.